Once again, thank you all for joining us. We're delighted to have you here. You'll see the webinar chat box. It would be really great if you could say hello in the chat box so we know who's here, because it is quite strange to still be just talking into a computer. So let us know who you are, and that would be great. But then once you've done that, you'll see down the bottom there is a Q&A button. And if you have any questions that you want us to address, then please put them in there and we will do our best to get to all the questions in the Q&A. We have quite a lot of people attending, so it may not be that we can answer every question today, but if we don't, we'll make sure that we can come back and feedback to you post the webinar. The webinar will be recorded and uploaded to our website. And so, which people have asked us to do, because people like to come back and have a quick look at it and check it out. And the closed caption function has been enabled, and we'd really appreciate if you didn't take photos or screenshots of the speakers. So I think we can now put down the slides, and I'm just a quick introduction from who's here with me today. So Chris.
Great, thanks, Rachel, and good morning, everyone. My name is Chris Tsigiti. I'm the Interim Chief Inspector of Healthcare at Care Quality Commission. Really good to be here this morning.
Brilliant. And Benedict.
Good morning, everyone. My name's Ben Knox. I'm Head of Communications for Healthwatch England.
Do you want to say a little bit more about Healthwatch England for people who know?
Yeah, Healthwatch works both nationally and locally. We've got 153 local Healthwatch branches, and we operate. Healthwatch England operates nationally, and our role is really to understand what patients' experiences of health and care are. So what's working, what's not, and to make recommendations to both the local NHS and social care system, but also to national government as well, about the issues that patients want addressed.
Fantastic. And Kevin.
Thanks, Rachel. So my name's Kevin. I'm a helpline advisor at the Patients Association. So typically we take calls from patients, family members who are concerned about their healthcare.
Fantastic. Thank you so much. So to get the webinar started, Chris, do you want to tell us a little bit more about the Share for Better Care campaign?
Great, thanks, Rachel. So,
is Chris frozen?
Yes, I think he has.
He has, hasn't he? Okay.
Do you want me to pick up that one?
Yeah, please do.
Yeah, sorry. Yeah. So the Share for Better Care campaign is a campaign that was set up by both Healthwatch England and the Care Quality Commission in partnership. And the aim of the campaign is to really support more people to share their experiences on health and social care, particularly groups of people that we're not necessarily hearing enough from, or groups of people who face the worst health inequalities. And the campaign was sort of developed using a lot of research around what motivates people to share feedback, what are some of the barriers that people face. And the campaign basically sort of works across England, and we've also got a number of partners, including obviously the Patients Association, where we basically work to encourage people to share their experiences of care, whether with us as organisations or with the health and social care services that they're using.
Brilliant, thanks, Ben. Chris, you've come back to us.
Yeah, I'm really sorry. I just disappeared on the screen, and I'm talking, and I'm like, Rachel, you just gone quiet for some fun reason. Then I realized I'd completely dropped.
Well, I can assure you that we couldn't hear you, and we were not ignoring you.
Okay, super. So, I might as well did you hear the beginning, or should I just start?
We didn't hear anything. So if you just start, Ben started to try and cover, but I really I think people would like to hear from the CQC about why this is so important.
Amazing. And I'm really sorry, colleagues on CORE. It's yeah, rely on technology, but sometimes it just lets you down. So, anyway, Ben, thank you so much for covering. So, I suppose the Share for Better Care was launched in March 2024. And it's like Ben was saying, it's a joint CQC and Healthwatch England campaign. It is also supported by a range of excellent partners, including the Race Equality Foundation, National Dignity Council, Royal Association for Deaf People, National Voices, the Challenging Behavior Foundation, the Patients Association, Voice Ability, and Disability Rights UK. And the main aim is to increase the range and volume of people's experience of care, as well as being a campaign partner. The Patients Association has been a CQC Tell Us About Your Care partner for a decade. And I just wanted to take an opportunity to thank the Patients Association for everything they do to support our initiatives and everything they do in being the voice of people, and also thanking other partners for their support in this initiative. We appreciate every help we get from everyone to broaden our reach with a range of audiences which we don't always have access to. So thank you very much, colleagues. At CQC, we believe people using health and care services, the unpaid carers, families, friends, and advocates are the best sources of evidence about their lived experiences of care and how good it is from their perspective. So it is really vital, important for us to hear people's perspectives. We try by all means to champion this in our work and value people's experiences as highly as other forms of information or data, such as inspection reports we use. We also want to encourage a culture where it's routine to give feedback about health and social care experiences, regulation driven by people's needs and experiences is a core strategy ambition for CQC, and it will continue to be going forward. We have also published principles for how we use people's experiences in our regulation. So Share for Better Care then aligns with the government mission to build an NHS fit for the future, to address some of the challenges we see in health and social care. However, while we understand the value of people's feedback, there's still room to improve the volume and range of experiences that are shared with us at CQC. In March, we launched Share for Better Care, a campaign to encourage more people to share experiences of health and social care, with a specific focus on people more likely to experience inequalities in terms of access, experiences, and outcomes of care. Our main target target audiences are people more likely to experience poorer care and inequalities. For example, people with a learning disability and autistic people, people from Black, Asian, and ethnic minority communities, deprivation, people who are disabled with physical or sensory impairment. So we are trying by all means to increase feedback and the voices of those people so that we can incorporate in the work we do here at CQC. So Share for Better Care then focuses on the insight that people are more likely to give feedback when they can see it has made an impact. But we want people to know that their feedback, no matter how small, has the power to transform health and social care across England. Our campaigns are digitally led and are one of a number of strands of activities to increase the range and volume of people sharing care experiences. There's a wide range of other activities to reach people who are digitally excluded, including our Experts by Experience program, which involves the public in inspections and activities, and it makes a big difference in us understanding people's experiences. There's also the public engagement network, which is made up of charities and community groups who represent diverse communities and people with protected characteristics. We also have local Healthwatch. We collaborate closely with Healthwatch, like Ben was saying, to build effective local relationships with our inspection teams. A crucial part of this partnership is gathering intelligence on local people and care services from Healthwatch, including patient experiences, then to inform our assessments of services and also the future work we do when it comes to inspections and assessments of services. And lastly, the work led through regulatory coordinators who undertake day-to-day provide engagement activities. For example, local Healthwatch, local advocates, patient participation groups, local voluntary and community organizations, including inequalities local outreach projects, including an inequalities local outreach project, to hear more from people from seldom heard communities. So the whole point being, how can we reach more people? How can we reach people who use services or access services so that they can share their experience in order for us to understand those experiences going forward? Feedback is important to us and helps health and social care services to improve, as well as celebrate great care staff provide. You know, we are here to listen and review what people tell us, no matter if it's good or bad, big or small. We still want to hear any feedback that people provide to us. Every piece of that feedback is looked at by one of our inspectors. Since 2017-18, over the last 5 years, we've seen over a 300% increase in people sharing their experience. In our recent National Review of Maternity Services in England, around 10,000 experiences were analyzed to give us insights on people's experience of care in maternity services. In our state of care, our view of quality and safety is informed by information that people have shared with us through the online give feedback on care service, phone calls to our customer services center, and social media, including deepening our understanding of the experience of people with access services for cancer, for example, exploring how people are accessing GP services and the quality the care they receive when they go to their GP services. Also understanding the experience of people who are entitled to free NHS dental care, also representing the experiences of autistic people when engaging with mental health services. So our campaign, Share for Better Care, is grounded in research and insight. I think that's the summary I just wanted to sort of convey to you this morning in terms of why it is really important for us to incorporate people's feedback, to incorporate people's experience. We can't do what we do without hearing from people's experiences. And it matters most to all of us here at CQC to hear people's experiences. So I'm grateful, Rachel, to colleagues who have helped us for example, to have this conversation so that we can talk more about this initiative. I'll pass back over to you, Rachel, if that's okay.
Brilliant. Thank you so much, Chris. Now, I think that was a really helpful introduction, and I'm seeing already questions in the chat and some of the questions in the Q&A, and please do put your questions into Q&A. That there are barriers and that people often don't feel listened to, and we hear that regularly across the health and care system. And the one role of the patient association is around patient partnership and design and delivery, and we can only do that if we're listening and being able to feed back. So I think what I want us to do now is I'm going to come to Kevin and Ben, because I know, Ben, you've got a piece of work that you've done on this, to maybe just explore what we hear, and then together with the Q&A come to some ideas about what's the way forward to make sure that those voices are really heard in the system, if that's okay. So Kevin, can I hand over to you and ask you to tell us a little bit about what you hear on the helpline, because you've been working on our helpline for about 6 years now, 7 years probably.
Yes, thank you, Rachel. So we hear from a number of patients, family, friends about their experience of healthcare. We often talk to them about the benefits of giving their feedback to the CQC as regulators, and that the CQC are keen to hear from people about their experiences of healthcare. Within that, though, there are people who will say, well, I've already done this, or regarding this particular issue, or about a previous issue. So they might have given feedback in the past regarding care they themselves had, or it might have been a relative. So one of the things that comes up very frequently is that people feel that they have given their feedback, but it's gone into the ether. They've not heard anything since. And I think there's a feeling or a concern that nothing is happening with their feedback. So I know that where people, for example, give feedback online through the online form that the CQC has, that they get an automatic reply thanking them and so on. And I know when we ourselves give feedback on behalf of patients or family, we get that sort of confirmation that they've received it. And often we will get information from an inspector that they would like more information, or they would give advice about, well, has that person made a complaint and so forth. But I think generally there is this concern that patients and family who are giving feedback um, don't feel that anything practical is happening regarding that feedback, and therefore they feel, um, well, is it really worth my time and effort? Is anything going to happen? Um, I'll just give you a brief example of this. So oddly enough, I received an email uh, query about 2 days ago, and it was to do with poor hospital care. And I replied to the person, and I suggested that they give feedback to the CQC. So they actually came back this morning and said that they're not sure how seriously the CQC take our concerns, aside from logging them and sharing the feedback with the hospital. That isn't good enough. Neither the CQC have shown an interest in our concerns. And they go on to say 5 years ago, the CQC inspected the hospital, yet there's no improvement. Patients are being harmed. So I think that's an example of some of the issues that patients and family who give feedback are concerned about. And I think perhaps looking at ways to increase the confidence of people who give feedback that something is happening with it would be a positive step.
Brilliant, Kevin. Thank you. We will come back to all those because we're going to identify those barriers and then see what we can do, Chris, with you and the team to really reassure people what does happen when they feedback, because we need people to feedback. So, Ben, I'm going to hand over to you.
Thank you. Yeah, I thought I'd just say a bit about some research that we have undertaken to understand a bit more about the barriers that people face when it comes to giving feedback and what motivates people and what puts them off. And so we've undertaken a couple of bits of research. One bit is around polling. So we commissioned a poll with around 2,000 adults in England. And we also ran a number of focus groups with specific communities, really looking at people's general attitude to feedback, but then particularly about their attitudes when it comes to feeding back around health and social care. And I think the findings were quite interesting. So I think there's a general, stand back a bit. I think, we do live in a time where people are increasingly being asked all the time for their views on things. And that's partly driven by technology. Where every time we use a product, we get an email or a call saying, "Will you give us your feedback?" But most people do it, and they do it because actually partly they think it's helping to improve the service, but also we use those reviews of services to help us make judgments about things. And so when we commissioned the polling, I mean, it was like 8 in 10 people, either very regularly or often give feedback about a product or service. And the reasons for that are largely positive. It's because they want to say thank you, they want to help improve care, they want to help others have a better experience. And when we asked the same question about health and social care, unfortunately, that number dropped quite drastically to around 4 in 10 people said, "Oh, well, I have a memory of giving feedback around health and social care services." And so we wanted to sort of dig into that and understand a bit more about why that is. So I think there is sort of broadly speaking, there are a couple of reasons. So one is really about, I think, sort of perceptions of the NHS. There's definitely a view that feeding back to other, non-health and care organisations is easier. There's also a bit of a perception that not sure something's going to happen with this. Do I really believe that health and social care services is going to act on what I say? There's also a bit of a belief that it's that it's going to be a bit more complicated, a bit more bureaucratic, a bit more faffy than they might experience with a private sector company. But there are also some differences I think we have to recognise. So obviously, when you're giving feedback about health and social care, you're often talking about a very personal thing that's happened to you or a loved one. And actually, that can be really quite emotionally taxing. And I think that's something we do need to bear in mind, that actually when people are feeding back and we're asking them to share their experiences, that actually sometimes reliving that experience is not particularly comfortable, that someone wants to do that. But however, there were some positives in the polling that, obviously people really, really, really value health and social care services. But I think the task is to give people the confidence that their views will make a difference. So we also commissioned some focus groups to sort of dig in a bit more around particular attitudes. And I think one thing was very, it was very clear in terms of the context. So obviously, I think we're all aware that, that confidence in the NHS has fallen in recent years. And that was very much reflected in the focus groups where, we'd run some similar focus groups during the pandemic, and it was really, really clear that kind of era of goodwill, towards health and social care staff, had worn off a bit. There was certainly the attitudes towards health and social care services were somewhat more cynical, but there was also a kind of feeling that the problems facing health and social care were so systemic and so big that they were beyond an individual's ability to affect them. So that was a bit of some of the barriers that we faced in terms of the general context, but there were also some specific barriers that we always see. So, do I believe that services will act on my feedback? Will me sharing my experience have personal repercussions on my care, or the care of a loved one? Will often there's obviously, because there is obviously goodwill towards NHS staff, that people don't want to cause a problem. They don't want to cause a fuss. But there was also that attitude about actually, this is going to take time and effort. There were also, I mean, we ran the focus groups with particularly people on lower incomes, and also talked to people in different ethnic community groups. And what was clear that those attitudes weren't necessarily different between communities, but in some communities they were definitely more entrenched. People felt definitely, less able to affect change. So I suppose our kind of, the question is, right, what can we do about it? So from a, when talking about that, what people, whether it's Healthwatch, CQC or the NHS can do to increase feedback, there were definitely some tangible recommendations that came out from the research. So in terms of a sense of powerlessness, when we are able to provide really tangible examples of where services have listened and acted on feedback, and it's the small things which count, actually people feel really, really, really motivated. So, we talked about real examples of where, feedback to Healthwatch, has helped to result in improved, better opening hours, or it's helped to improve food and services, or it's led to, a refresh of a waiting room. They're tangible things. And people definitely felt more motivated to give feedback. I think definitely there is an issue around making feedback as easy as possible. I certainly, when you deal with some bits of the NHS, it isn't necessarily always easy. We've had to look at our own process to say, are we making this as smooth as possible? There seems to be a view that really, if for example, an online survey, if it takes more than 3 minutes, most people are going to be put off because, we have busy lives. There was also around emphasizing the benefit for people. I think that's a real thing that we always try to do, is around emphasizing the benefit, not just for you and your family, but also for your community. Making sure that communications are accessible. I think we need to try and, wherever possible, avoid a kind of one size fits all. Is information being provided in the right formats? Are the people, reflected in imagery, or the spokespeople, do they reflect the community that I come from? Is the NHS visibly in communities trying to collect people's experiences? And then there's the other points about, making sure that it's, it's confident, but really emphasizing the point that it's confidential. And going back to Kevin's point, that did come up, well, what happens to my experience once I give it? There was this sort of fear that, does this just disappear into a black hole and I'll never hear again? So it's really, really important to acknowledge people's experiences and be and say what happens next. It might not, so for Healthwatch, for us, it might not lead to immediate change, but what it does do is it gives us the body of evidence we need to make a case for change. So those were the overall things that we found.
That's really, really helpful, Ben. Thank you. And Chris, I'm going to come to you in a second, because I think looking in the chat and looking in the questions, I think sometimes, and I know from the work that the Patient Association has done over the years around complaints and genuine two-way communication and listening to patients, is that quite often, if you give your feedback and you don't know what's happening with it, you feel like Ben and Kevin has said, it's been disregarded. Or you get back kind of that stock answer. And what we found with people that we did work with was trying to get them to understand that it's okay sometimes to say this, we're not able to do anything with that piece of feedback right now, but it'll do this. What's your view on how CQC can do that?
Good. No, thanks, Rachel. Yeah, I've seen some of those questions in terms of actually, what do we do with people's feedback? And the starting point is, we take people's feedback seriously, and majority of that feedback informs what we do in terms of some of the intelligence we are gathering about services. So, we end up sometimes going and doing an inspection because we are gathering information. So, for example, people might tell us, raise a concern with us, and it might be a starting point of actually us looking into that organization to think about actually what else is going on in that organization. When we bring the sources of data and information together, plus the feedback we're getting from people, it then helps us to really understand, that service. We've seen some services, for example, for children and young people, where we had lots of feedback from families, from the children and young people themselves were using those services. And the more we looked into it, and the more we took other, feedback we were getting from other, other stakeholders, it helps us then to build a picture about how good that service was and some of the challenges people were facing when they were going into those services. So a good example is when we did our state of care, for example, we used people's feedback. We spoke to children, young people. If some of you have read our state of care report for this year, we had people who were talking about the experience of care. Even though we didn't name names, we put them as case studies in our state of care report, actually talking about people's experience of care, using people's own narrative and words of actually, and they were happy for us to use, as long as we were not naming their names. They were more than happy for us to use that feedback and reflect on that feedback. So you see our reports, there is that feedback of people who are using services, and we're using that feedback to tell a narrative. And it's not always about a negative experience. So we had an example, a young person was telling us about the challenges they were having in community mental health services, and they struggled then to go back to school because they were not getting the support they needed. And hence they were worried about what's going to happen in terms of their lives going forward. And then we had another young person who was talking about their own experience of having a really good social worker and community mental health services who supported them, and they were able to go back to school and able to finish, their A levels, and now they're heading towards, university. So, but it's different experiences. But what we're saying is we're trying to bring all that experiences and reflect all that experiences in some of our thematic work we're doing. But the first point is we can do better. Definitely, we can do better in terms of reflecting people's feedback they give us in what we do next. We can definitely do better.
Yeah, and I think that was going to be my reflection there, Chris, because we have commented every year in the state of care report, and we've given evidence into the state of care report. But I suppose if you're an individual and you're feeding back, it's how you use people like us and Healthwatch.
Yeah.
And I suppose I get it, like the ideal world is everybody would get a personalized response
Yeah.
to the concern that they have raised. And,
Yeah.
you know, that should be the gold standard that we
Yeah.
go for.
Yeah.
I get that that's another whole
Yeah.
conversation, but I think that's what you're hearing quite strongly
Yeah.
in chat and in the Q&A.
Yeah.
But if that's something that is a stepping stone towards what we can do, I think maybe there's something that we can do with CQC
Yeah.
in more, you know, we heard you,
Yeah.
you said we heard
Yeah.
state.
Yeah.
And I think that was something that when the ICS levels were being set up, we were kind of saying to government, you really need to make sure there's a statutory provision to feedback generally on
Yeah.
complaints. We're not saying everyone, but there
Yeah.
needs to be something because, you know, there's lots of conversations about the NHS is broken, all of these things.
Yeah.
But together as patients, carers, family members, the regulator and the system, together, if we are listening and genuinely communicating with each other,
Yeah.
then we will help rebuild that system fit for the future.
Yeah.
And we're just about to launch consultate our own survey on the new 10-year health plan. And I think this will be key to it, is how will you respond, not just CQC, but how the system responds specifically to complaints. Because there's somebody in the Q&A there who talks about the fact, and I'm gonna talk about power for 1 second, but there's somebody in the Q&A who talks about being a healthcare professional, her mother having a bad experience. Now she is going to be able to, she has the skill and the knowledge in which to complain, and will do it because her words are, I feel very motivated to do it. And I know that from some of the people I've been talking to recently. But I think I think it goes back, Ben, to your comment there about increasing confidence. How do you think, Ben, we could increase the confidence of the public to do this feedback?
Well, I think there's the practical steps. So I think the more that we can show, so follow that thread from someone's story through to the difference that it's made, the more we will be able to increase impact. Increase confidence. Sometimes that's not always easy. You know, some people don't always leave us their contact details, but they do share the story. So, you know, I was thinking of an example where, you know, with someone shared a story with a local Healthwatch service about how their local GP had changed their opening hours, but their new opening hours, didn't operate at the same time as the local bus service. And they shared that story with Healthwatch, and Healthwatch were able to take that one story and go to the GP and say, you might have a bigger issue here. And the GP went and worked with the Healthwatch to talk to the local community, change back their opening hours, things back to normal. Now, you know, that's a nice story showing actually how one person's story can make a really, really big difference. But actually increasing confidence, I think, would be where the NHS is actually, before they change the opening hours, is actually talking to their patients and saying, is this going to cause a problem? And so I think there are sort of practical things we can do, you know, so trumpeting the differences that people's views make. But there is, I think, a more systemic problem that needs to be addressed, which is that kind of culture of listening within the NHS, you know, whether it's at the frontline service about how involved people feel in their care, you know, when I, you know, do I feel able to give feedback to my clinician about what's working and what's not when it comes to my care? You know, to what extent are NHS managers and social care managers using feedback as a way to make judgments about services? But also, you know, really, are we judging the performance of health and social care services on people's experiences? Well, currently a lot of NHS performance is actually judged on individual outputs and numbers, you know, how many treatments have happened. It's not about what was someone's overall experience. So I do think that, you know, to your point about the 10-year plan, you know, it's one of these rare moments we get to think about how we can build a better health and social care service in the future. And I do really, you know, and I know that your organisation, our organisation, is really making the case that, you know, patients and their voice really needs to be at the heart of that.
Absolutely. And Kevin, can I come over to you? Because one of the things I know that we hear in the helpline, and it's one of the barriers that Ben brought up, was that fear of repercussions. Your loved ones in a hospital bed, or you're getting treatment. What do you think could be put in place to overcome that barrier? Do you have any ideas on it?
I think that's a very good question, Rachel. I'm not sure of what could be put in place, but there clearly is this concern or worry amongst people who want to give feedback that if they were to do that, then there would be repercussions for the patient or for themselves. Um, Although one of the things the CQC does have in place is that people can give the feedback anonymously, so without identifying themselves, of course, which is a great thing to have in place. However, sometimes where somebody might give feedback, the very nature of the feedback might reveal who that person is, and that sometimes is the fear of those people who want to give the feedback. So I think allowing people to give feedback anonymously is a very good idea. But I think perhaps thinking about what could be done to allay people's concerns, that there will be some fallout from that feedback. I mean, typically what we would suggest on the helpline, if they're concerned about that, is to give the feedback anonymously, or give the feedback after the patient has left the care of the provider. So, for example, the hospital. So I don't know if that helps at all.
Yeah, no, that does. That's really helpful about the anonymous part.
Mhm.
And I suppose, Chris, I'm going to come to you, because I do think that the fear of repercussions, and it is around power, and, you know, majority of the time, if you're in having a treatment, the healthcare professional does, because Ben, you're getting a lot of pickup on the partnershiping with patients and designing with patients. But, you know, there are some good examples of that in the country, but it's not widespread by any means. So, Chris, what would your feedback to people who are saying, I'm too scared to give my feedback because my loved one may have a it might have a detrimental effect on either me or my loved one?
Yeah. No, and Rachel, those fears are real. I've had opportunity to speak to families. Over the last 24 months, I've been with the CQC. I've spoken to so many families and patients, and people talk about the fears of actually, what about if I say, what about the impact on the care that my beloved one is going to get? But it brings back the point that Ben was making in terms of the culture. What culture do we want to see in our health and social care services? It's the culture of advocating for people and encouraging people to give feedback, because if ever we are going to improve health and social care, it's the feedback we get from people who use those services. So for me, my encouragement to people is, one, continue to give feedback, but you can also do that anonymously. I think one of my colleagues did speak about that. I think Kevin was just talking about anonymously giving feedback. But there are other ways, like we collect feedback from people. Rachel, the work we do with you around tell us about your care, online, give feedback on the care services, the phone calls we get to our customer service center. So there are other means of giving feedback anonymously, and we will take that, whether it's anonymously or not, we will take that as seriously as possible as we can. But the other thing I want to reassure people online as well is, the other thing we're trying to do is to encourage, inspire organizations to take feedback as a positive step, right? So I spent time the other time, I was talking to 90 chief executive officers of organizations, and I've been talking to chairs of, for example, mental health services. And my challenge being, what are you doing in terms of encouraging feedback? So, actually targeting on the board of those organizations to say, what are you doing? What's the culture of feedback you are using in your organization to ensure that you encourage people to give feedback? And we're starting to see some changes in some organizations. We're starting to see some organizations actually having some more senior representation, like having a director of patient experience, for example, someone who's got a lived experience, but someone who understands what it is like to be someone who uses services, or someone who has supported someone who uses services. But if we continue pushing and actually changing and making sure actually leaders of services and leaders of organizations do understand the benefits and the importance and the positive impact of what feedback can do to improving services. And most services we see will improve. They take feedback on board. They absolutely, we have seen services who were inadequate before. And when you look at the work they've done with, for example, people with lived experience or expert experience or carers, the work they've done is absolutely inspiring. And you can then see why those services have now improved from inadequate to good or even outstanding. Is because they're taking the voice of people who use services at the center of everything they do before they make any changes. So for me, the encourage is, please keep on giving feedback because it's important.
I think you're so right there, Chris. And I think we often at the Patient Association talk about a philosophy of care for staff, so that patients can have really good outcomes. And I think when I used to do some training around complaints in healthcare systems, it was being, that healthcare systems should be really thankful when they're getting feedback from patients, families, and carers, and actually see it as a massive learning opportunity. And you are right, Chris, that there are places where I think that happens really, really well. Because I fear, and there's a lot of conversations in the chat and in the Q&A around power imbalances. And I fear that, and it's great, health watchers are doing fabulous jobs and seeing there, and I see my helpline team and what they do to give patients power to put that complaint in. But if you're knocked back at the system level or at the treatment level, be it, your primary care, secondary care, wherever, having that power to come and then go to the CQC about it is actually a big thing.
Yeah, it is.
How do we get the system to really see, Ben? Maybe how do we get the system to see what a big thing that is to have that courage? Because sometimes it has to take huge courage.
Yeah, it is, and it comes back to leadership. Rachel, I'm telling you, it comes back to leadership of our health and social, care services. Because, like I'm saying, when you've got a chair and a chief executive officer who turn around and say to people, your services and their families, their carers, to say, listen, this month I want to hear from you. I want to listen. I really, really want to listen. Do you get what I mean? And I'll do something about it. But remember, the point I think Ben, you're making is, when people who are courageous, who give feedback, right? Then they wait and see what you're going to do with that feedback, right? So when they see there's a positive impact or change, then when even people are talking themselves, they can say, I actually did give this feedback. And there was something that happened. Then it encourages other people then to want to give feedback. But I get the point about, actually it's hard when you've been knocked back before to then try and go and give feedback again. But for me, I think it's one, trying to make sure actually at system levels, do we have the structures that enable people to give feedback? That's why I'm really grateful for Healthwatch, Patient Association, because you enable people. When people think actually maybe I can't give feedback, but it's actually saying to people on call, your local Healthwatch, talking to Patient Association to help you to be an advocate. The PALS service, like the Patient Advice Liaison services in hospitals. I know that some people have not had a positive experience of that, but I have also seen positive experience of that. I'm a mental health nurse, by background, and my first job in the NHS was a healthcare support worker. And I spent a lot of time talking to families when I was a nurse. And our patient advice liaison service was so helpful in advocating for people. But it's not across the board. That's the challenge. That actually it's in pockets, isn't it? You've got some areas where it's working well, but some areas where it's not working well. So I think there has to be a collective view that we try by all means to encourage, one, leadership, the culture of giving feedback, working with Healthwatch, working with Patient Association, working with PALS. I think we have to be a collective bringing it all together if we're going to make change. Only one way of giving feedback won't work. I think we need multiple sources.
Well, I'm gonna come to Ben in a second to ask about some ways that could be more accessible, what you learned from your paper, Ben, your focus group work, all of that, how we could become more accessible. But first, Kevin, I'm going to come to you. And I just, when somebody rings the helpline or emails the helpline, and it is National Free Phone Helpline, so we're delighted. And really importantly, we have a phone line that gets answered to people, because I think that's massively important, like the local work that Healthwatch does with local communities as well. Kevin, what kind of would you advise people? And they ring you and they go, I need to tell CQC, but I'm really concerned.
Well, I would say it's important to give the CQC that feedback, because typically if the CQC doesn't hear about it from that person, they're not likely to hear about it otherwise. So it may be, or there may be very little chance, for example, that the hospital would point up the issues that that family member or patient or friend has noticed. So we try to encourage people to give that feedback, and we try to stress the importance of giving that feedback, because it can help perhaps that patient, but hopefully also other patients and users of that particular healthcare provider.
Brilliant, thank you. And Ben, in the research that you did, and I think there's somebody's put in the chat or the Q&A, I'm trying to keep my eyes on both of them. They talk about a customer charter and kind of values and partnership, and maybe that is something that CQC could kind of think about in terms of, together, this is what we can do, patients and CQC. But in terms of making it accessible, so, getting to people who may be living and experiencing poverty. We know that that's one of the big inequalities, or English isn't a second language, all of those things. Do you have any ideas on what CQC could do to make that more accessible?
Well, I mean, I can speak generally in terms of what I think we all need to do. So I think, as I was saying, there are making the process. So I mean, things are becoming increasingly digital, and the public sector is not always at the forefront of digital innovation, compared to many private sector companies. And we need to make that experience of feeding back as easy as possible. Even simple things like, we've been looking at like our online form and saying, right, how long does this take to fill in? Because people tell us they're not going to spend more than 3 minutes doing it. How do we make it as easy? Because there are things like, even like big open text boxes, it puts people off because it looks like it's going to take a long time. So you've just got to, so looking at your own processes and trying to make those as easy as possible is definitely one step for those who want to feedback online. But there are also, I think, a lot of other things around, not trying to treat communities in a sort of one size fits all approach. We definitely, if you're trying to talk to a particular community about their experiences, making sure you're doing that in the right context, using the right kind of channels, as it were. So, for example, I think of some work one local Healthwatch did with its local Chinese community, where actually they worked with a local community group. They held an entire conversation on WeChat in Chinese, and were able to gather that feedback. Now, that was the channel which we would never have been able to reach. So actually working in partnership with people to reach out to communities is really, really important. I think there's also something about actually long-term about visibility. It was something we definitely heard from our groups around, that particular communities didn't feel like the NHS was out in their communities asking them what they wanted from their health and social care system. It was always, there was kind of a view that, we get asked occasionally about these big bits of work, and then we don't hear from anyone again. And so I think there was a very strong view that people really, really wanted to see, people coming to them and talking to their communities, so for example, turning up at a mosque to talk, being out and about and being seen. And that's really, I think, that combination between, making sure we get those mainstream ways of communicating that people like to use nowadays, like digital, getting those right and making those accessible, but actually also that outreach into communities with partners is really, really, really critical to make sure that everyone has a chance to have their say.
We did a piece of work with focus groups, and we went into areas, into communities, but areas of high deprivation. And a lot of what we heard through that piece of work was, I don't see myself in this. I don't see, do I see myself when somebody's asking for feedback? I don't see myself. I don't think they're asking me for the feedback. And there's something really important about that I do think CQC could take on board. And I know there's other groups in CQC. So we are running out of time. This always happens because there's so much to discuss. So Ben and Kevin, I'm going to ask you for one tip each that you would give to a patient or a family member about maybe how to make your feedback more effective. And Chris, I'm going to ask you the same question as well. So Kevin, can I come to you?
Thanks, Rachel. So one of the things I think that may help people in giving feedback is to look at the 5 main areas that the CQC are concerned about. So those are, was the service or the care provided, was it caring? Was it responsive? Was it effective? Was it well led? And was it safe? And the idea of giving people that information is that it can guide them to look at, well, in terms of the care that was given, does it meet the mark of being safe? So if there are issues to do with how safe it was, then using that heading and putting the issues that applied there. But again, if there are issues as well to do with how responsive the care was or how caring it was and so forth, then trying to do that to in a way help the person to also focus on what had happened. So the main things they want to pass on to the CQC, but also I think to some degree it may also help the inspector when they read the feedback to understand particularly how it applies to those 5 main areas.
Really helpful, Kevin. Ben, did you get nuggets of good tips through the work that you've done and what you hear from your local Healthwatch?
Yeah, no, definitely. I mean, I think the first thing I'd say is if you feel able, is give that feedback directly to the service, because and also I think saying what's good as well as what's bad. Positive feedback is also really, really, it's important that services understand when they're getting things right as well. And I think the next clear thing is just is either you or with the support of someone else thinking about, if it's before you meet someone face to face, trying to really think about what it is that you want to say. So, what happened? What was the impact on you? What would you like to happen? That's really, what's the sort of a good end result from your perspective? And also, I think there is something really powerful about actually, if you've got an idea about how the service could make it better, do say, because I think that's something which is often overlooked. Actually, the best ideas come from communities and the public.
Absolutely. Brilliant. Thank you. Well, Chris, you've been given lots of food for thought, and I'm going to say now there are some really good ideas in the chat and in the Q&A as well that we'll try and pull together so that you can take it away and think with your team. But so this is both, from a patient care perspective, from a CQC perspective. What would be your single tip to make sure that the patients are listened to?
I mean, the first thing, Rachel, is obviously grateful for all those who are already giving feedback, in terms of their experiences, but also wanting to encourage others to, to use our means of, giving feedback, like the online give feedback on care service. Use it, give feedback to us. We want to hear, but also to encourage people in terms of, when we go out to assess services, sometimes we reach out to other people who have used the services and they've left those services to talk to us as part of our inspection of our assessment process. So encourage people to do that as well, because then it's a direct feedback which is incorporated into our assessment and inspection of those services directly. So we would welcome that. And the last thing I'll say is, if people are able, to join as experts by experience, because that's another way of actually being part and parcel of the assessment and giving feedback, like live feedback as we do inspections. That would be really welcome.
How would people find out about becoming experts by experience?
I think, Jay, if you can put information and we can share the information with you, Rachel, as well.
Yeah, brilliant. We can send that out to people. That'd be really, really good.
It's an organization called Choice Support. We work with, we will support people to be part of our expert by experience. But it's another way of being involved and giving feedback as well, of hearing other people giving feedback, because expert by experience helps us to understand, because they're talking from their experience and they can sort of take a holistic view of what's happening when they hear other people's experiences.
Brilliant. That's really, really helpful. And I think what's come out of here too, and I've seen it in the chat and in the Q&A, is, and something that the Patient Association's been saying is, if we commissioned and if we built services with patients, and then we built services and carers, obviously, and we built services based on outcomes rather than activities, I think it would make it so much easier for us to learn and to develop those services, because I think it's very hard when it's by activity rather than outcomes. Okay, we are coming to the end. There is some really good stuff. We will pull all this out and make sure CQC get it. Ben, is there any last point that you would want to make?
I would just say just on one final point about giving feedback. So the government is running their consultation on the 10-year plan at the moment. And obviously we and I know the Patient Association will put in, what people have told us about what they want to see when it comes to the future health and care system. But I would also say, do have your own say as well. If you've got ideas about how you think the voice of patients could be stronger and how patients could be given more power in their own health and care, because you can say it directly to the government. So if you Google, is it change.nhs, I think?
Yeah, we'll send a link, and we send out an evaluation afterwards, and we'll make sure we put a link into there for that, so that we can, yes, this is this opportunity. So make sure you fill this in, because this is around patients really influencing that plan. Kevin, do you have a last point you'd want to make? Apart from the fact that you're always there to help patients.
Thank you, Rachel. So yes, we would encourage anybody who wants to give their feedback to do so, because we think it's important for the CQC to get the feedback and to consider how they're going to use it for the benefit of not only themselves or their family, but also for patients going forward.
Fantastic. Thank you. And Chris, you get the last 30 seconds. What is your final push?
Amazing, Rachel. Thank you so much. And honestly, I just wanted to say thank you, Rachel, to you and the Patient Association for all your help and supporting us to facilitate this session today. And Ben and Kevin, really appreciate your time as well. But massive thank you to people who joined online. Thank you for your feedback. Thank you for your comments and contributions this morning. Really, really appreciate everything you've said. And we'll take away, like I said, we need to improve. We are doing as much as we can to incorporate people's experiences and feedback, but I know we can do better, and we want to do better going forward. So thank you so much for taking time this morning to come and join us. Really appreciate it. But like I said, we wouldn't have done it without you, Rachel. So thank you so much for facilitating this morning.
And thank you so much to the panel, because I think it has been really informative, and I think just talking it makes me think other ideas. So we need to come back and do this again. To the participants, thank you so much for joining. We really are grateful that you come to our webinars, and thank you for some lovely feedback that's coming in, and the best of luck with feeding back, but don't give up. Keep feeding back, as we will get that partnership with patients. And thank you. I think there's another slide coming. Holly, is there, about our helpline? And we will be in touch to get feedback as well.